Good guy. Yeah, can you talk a little bit? Huh? You're not going to make any noises for me? Well, what's wrong? Yeah? Are you just
That's
not
not a
getting
stuffed
enough
animal
attention?
making
Is that
those
what's wrong?
noises. That's Oscar, a robotic seal that could help treat depression and anxiety in dementia patients.
Okay, you had a long ride
Nursing
over here.
professor
The
Dr.
cold
Petersen
wasn't
is
very much
currently
fun.
researching the topic.
Oscar is actually a Paro robotic pet, and his brothers and sisters and Oscar were first invented by Dr. Takanori Shibata. In 1993, he set about to develop a robot who simply could help people.
Alzheimer's, the most common form of dementia, causes memory loss and has become a growing problem. More than 5 million Americans are living with the disease. Petersen says dementia patients have largely been ignored and often just treated with medicine.
And we know that medicines can manipulate neurotransmitters, but we know that so can the Paro robot, like Oscar. So it's much better not to give medicines if we don't have to. And we know that Paro now, as well as pet therapy, has been effective in treating anxiety and depression.
This is Dr. Petersen's second year to be working with the robotic seals. She used Oscar at her geriatric practice in Dallas to help an Alzheimer's patient who had violent behavior.
We started treating him with Paro, and he quickly calms when he gets the robot. He has started talking to it. He hasn't talked in 7 years, but he began to say, oh, how beautiful, and just stroking the robot. And he went from that to talking with the nurse who was facilitating the robot treatment. And now he's talking with other residents in our group activities. So he went from totally nonverbal to being able to reconnect because he first talked to the robot.
Petersen, an associate professor in the Family Nurse Practitioner program, has been teaching for 3 years at the university, but she has been in the nursing field for over 30 years. Professor Dr. Carol Reiser, a colleague of Dr. Petersen's, describes seeing Oscar for the first time.
Because she brought it to a faculty meeting recently, and here's all the faculty sitting around a big boardroom table, and she brings the seal out, and everybody just immediately starts to relax and say, oh, how cute, I want to see it, and it will interact with you, it remembers you, and even faculty who had already met this Oscar reacts to them differently than a new person.